Welcome to Venice, a city like no other. In a city where history meets the future of medicine. A unique forum for innovation, collaboration, and excellence. Meet the expert, May 9 and 10, 2025.
So here we are in Venice. I'm with an amazing and so honored to have you here, Lawrence Lenke, for friends Larry. I mean, I know that sometimes you say Larry. How can I address?
My mother would like to be called Lawrence, but everyone started calling me Larry when I was young, so Larry it is.
Larry it is. Okay, thank you so much for reaching us after a long flight from New York. So we know very much about you. But one thing that no any journalist would ask you at the beginning is that you are from Chicago. Yesterday, the new Pop, we discovered that has some link.
Yes, so I am from Chicago. I spent basically 21 years there, my young growing up years. I did not know the Pope. I am Catholic, actually, and so I have certainly a vested interest in the Pope and in the Catholic tradition, but I did not know the Pope, but I think it's fantastic that we have the first American-born Pope ever. I mean, that's kind of amazing. I never thought that would happen in my lifetime. But the bottom line is, he's obviously an international pope. He spent time in Peru, and he's an America's pope, basically. So, but I think it's truly wonderful and a happy day for America, and American Catholics, and all people.
Many Catholics from not only United States but Americas. So they say that it's also a step ahead.
Exactly. Well, we think so. Hopefully, I mean, the bottom line is, I think he obviously deserved to be nominated for this very important position. Now, this is a very serious, obviously, candidacy and position to obtain. So he obviously did the right things to sway the other cardinals to vote for him. So I will have to trust that process, right? It's been a process going on for a long time.
Yes, exactly. So we are very happy to have you here. And the first question is, what made you accept this invitation? Because we do know that all the participants were really waiting for you here. So you get so many invitations.
Well, I appreciate that. I mean, I'm obviously honored to have a role in educating not only myself, but and learning from others, but helping others do better spine surgery, especially complex spine surgery, which is a different level. I really accepted mainly because I was at the last meeting a few years ago, and it was fantastic. It was, I think, the discussions, the presentations. I mean, I learned so much. We always learn. We're always learning. But I learned probably more at that meeting than almost in any other meeting I'd ever been to in a small focus meeting. So that's why when I heard about this meeting, got invited to come back this year. I really kind of moved things around. Although I do have actually a wedding to go to tomorrow. It's actually a complicated weekend for me, but I'm glad I was able to make it, and I really look forward to the meeting. It's going to be a fantastic time.
Two questions. First one is what you will speak about,
Sure.
which is the message that you tailored for this meeting.
So I was asked to give two talks. My talk today is on the treatment of complex pediatric spine deformity, and then tomorrow my talk is on the use of posterior vertebral column resection for severe deformities, and I'll include children and adults in that talk. So because of my talk tomorrow, and many obviously pediatric deformities that are complex and severe, we do use posterior VCR to treat them. So today I'm actually going to talk of all my discussion is going to be not doing VCR. How do we approach complex pediatric deformity? And the title is over 120 degrees of deformity, which is quite severe deformity. How do we treat those patients without a VCR for whatever reason? So I basically have my thought processes and what I think about how to approach those patients very individually, and what techniques we can use: halo traction, pre-op, intra-op, other osteotomies, other techniques. Basically, accepting less correction. I mean, when the risks are maybe higher than the benefits of doing a VCR. So I'm approaching it kind of in a philosophical manner, how to really look at a patient and really think that a posterior VCR should be your last resort. What can I do more simpler to the patient with less risk to obtain an excellent result? So that's what my first talk's going to focus on, and tomorrow I'll get into the details. I'm sure many surgeons want to know of how I kind of analyze and perform a VCR procedure.
This idea of the final point you should have clear in mind before starting was also a point we discussed with another Dr. Boriani. Said when you have a tumor on the spine, what is better to do? If the tumor is aggressive, we have to be surgically aggressive, but you have to tell your patient that he will lose the function maybe. But I always question myself if this easy stuff for me that is okay, better to lose the function and to survive is still okay or not. What is your point?
Well, a complex deformity, these patients, normally won't die immediately from the deformity. I mean, obviously there are patients that have severe myelopathy, cannot walk, or are bedridden because of their severe deformity. That's unusual. Most of these patients are fairly functional, but obviously slowly deteriorating in the quality of their life. The quality of their adult and pediatric life. So I think we have to balance that with our surgical aggressiveness. And so it's really a interplay between, I think, understanding what the patient's goals are. I mean, this is a shared decision process. We discuss the patient's conditions with them. We discuss treatment options with them, and they're part of the decision process. Now, obviously, when it's really complex, they often turn and say, doctor, what would you think is best? So, you have to show confidence and have a plan. But I definitely involve my patients in the decision process of how aggressive we should be. This is a little bit different in tumor surgery, especially a very aggressive tumor surgery. That's a different, I think, conversation with the patient. Where this is, I think, balancing the risk-benefit ratio of complex surgery to get the best result possible in the safest manner. As I tell my patients, surgical safety is always priority number one, always. But close to that is surgical aggressiveness to obtain the best correction possible. Well, but again, safety will always trump any kind of aggressive surgical technique.
Larry, does being, we can say, well-known, famous, change something in terms of feeling the responsibility when someone, you especially very severe cases, even desperate ones, come to you say, doctor, like you are like God, do something for me. What changes inside you apart from the professional sphere?
I'm not sure. Honestly, I don't think I've changed much. You know why? It's because I have complications, and I think I have fewer complications I did 30 years ago when I started doing complex deformity. But, again, I may do 99 extremely successful complex deformity surgeries, and then surgery number 100 will have a complication, and that patient bothers me more than the 99 successful ones. So it really keeps you grounded. And I think anyone who really focuses on complex spine surgery, of any component of spine surgery, if you're really honest with yourself, it's really it'll keep you grounded, because anyone doing complex spine surgery has complications. That's just part of life. If you don't have complications, you're not operating. We all say that. So I think in that way, that's what's kept me grounded, is that I'm still striving. That's why I'm at this meeting. I want to learn some things to help my patients do better. I mean, I pick up points and educational aspects from every meeting I go to, because I don't have it all down. I have a lot. I understand it more than I did 5, 10, 20 years ago, but we still haven't perfected this yet. So I'm pretty grounded from that perspective. If you really care about your patients, which I really do, then I try and stay grounded. At the same time, you have to show some confidence, because someone comes in with a very serious problem. If you're not confident, you can look them in the eye and say, I can really help you. I've done this before. Then they go in really scared, and sometimes they don't want to have surgery. So it's a balance between being confident but not being cocky, or being overconfident, because that's when you definitely get in trouble. You got to kind of walk a fine line, and I think I've done a pretty good job with that in my career.
I think the results speak themselves. I have a last question, and then I have an idea, because we like to be innovative also in the way we speak. The last question is about educating young generations.
Right.
For the first time in the history, 6 generations, different ones, live all together under the same sky. From the Alpha generation, the last one, the Zen generation, and so on.
Right. I'm baby boomer.
Educating different people, what requires to people that have to design a course, for instance, or choosing which elements today cannot be missed.
Yeah, well, to me, education is basically it's knowledge, philosophy, and techniques for spine surgery. So the knowledge basically can be obtained through the internet now, right? There's lots of ways to obtain the knowledge, right? Through education, through knowledge, through training, right? So knowledge is actually quite easy to obtain. The philosophy is the tricky part. That's where I think these meetings really help. So I try and provide philosophy of how I'm evaluating a patient with a complex deformity and why I chose a certain treatment method, good or bad, and show the result to show what I learned from it. So that's I think the most important component of meetings is the philosophy, but also then there's a technique component. So obviously techniques are critical when you're training. I train 5 fellows a year that obviously spend hours in the OR with me every week, and so that's easy technical training. But I think so. Technical training in an educational course needs to involve surgical videos, intra-op photos, and we obviously know how to do that as well. So I think those are the 3 pillars of the educational process: knowledge, philosophy, and surgical techniques. And I think the knowledge, honestly, I don't think we have to stress as much in meetings anymore. It's so easy for attendees, especially the younger surgeons, to get the knowledge. I think it's the philosophy and the surgical techniques that make the difference in courses like this.
And I'm not alone anymore on my side. I will leave the space. For me, it's so painful to leave minutes of my waiting time for you, but I love very much Pedro, who is I would like to say a friend. Also, he's the chairman of this event,
right.
And probably also thanks to his reputation and love and passion we have you here. And I would like this chat to go a little bit ahead, speaking about really key opinion leaders, and because I was looking at Pedro looking at us, and I imagined how many questions were on his mind. So please go ahead freely. We manage the cameras, and we do know that from now on, maybe also very professionals can get better advantage of the call.
Thank you very much. And I am really unprepared, so I don't have yet questions for you, Larry. But I have one observation, and I don't want to overpraise, but one thing that I have always appreciated from you, and I think that disclosing this publicly can set what I think should be standards in our profession, is that you are an incredible professional technically. You have outstanding attention to detail, but then you have strong humbleness, and you have a hugely ethical approach to your work. And that is something that I think should be inspiring each of us, because technically good people, we have a lot. Those who pay attention to detail, we have a lot. People with ethical approach to the profession, yes, there is, but sometimes it is in conflict. And this humbleness, this lack of self-advertisement, just working hard and trying to find the right questions to get the right answers based on science. This is something I have learned from you, I have observed in you, and I think that there is something deliberate in achieving that. Could you explain on your personal pathway to be in that
Well,
position?
first of all, I really appreciate your comments. Others have mentioned that, and honestly, I'm pretty proud of that, honestly, in a humble fashion, because and I must give initial credit to my parents. My parents basically, not without belaboring it, neither had a formal education. They were basically high school graduates who just went to work and raised a family, myself and 2 children, with very meager means, and taught us the value of hard work and being honest with people. I was raised Catholic, and I'm not a rah-rah Catholic, but I like the attitude of helping others and being cognizant of others people's thoughts and conditions, and being of service. So I grew up in a service kind of oriented family. And again, I think part of as you get into a responsibility of training residents and fellows and leadership in educational courses, and being a more of a leader in whatever field, whether it's medicine, business, whatever. I think the leaders have a responsibility to have ethics as a top goal, and not everyone does that, as you know, and certainly in America and in business, I mean, that's been a really big issue. America's done very well business-wise, but sometimes not in the best ethical standards. So, I call myself a lead by example person. I don't go out there and really kind of push people to do something. I just kind of lead my life like I think is the best that I want to do, and if other people appreciate that and recognize that and will set a tone of example, then I think then I've done my job. And it sounds like you're aware of it, and although again I haven't really focused on that, I don't talk about it. I think that has been very important to me to make sure that I keep the ethical standards of what we do high. That be honest, because again, as I said, we all have issues, difficulties, complications, and we're all striving to do better. But if you're only all positive and not negative or not truthful, then it's hard to trust. Trust is really something that, if you don't have someone's trust, whether you're a patient trusting your surgeon or a colleague trusting another colleague who's giving you advice, then it's really difficult. So I think that's really important part of our profession, any profession really, but really important in spine surgery.
In our profession, there is one very critical, delicate point, which is, they call it information asymmetry. Mm-hmm. So your patients come to you or come to me or come to any specialist, and they know very little about their condition. Right. We know a lot. So we can guide them to any decision. They're
knowing more now with the internet. Patients are much more knowledgeable. Now, maybe not in the right knowledge, but they have a lot more knowledge in general than they did 20, 30 years ago, as you know. Wouldn't you agree with that?
Yeah.
They do. Yes, at least in America, they do. They come in quite knowledgeable or seeing many other surgeons for opinions.
Yeah, I think that is a thing. But how do you self-regulate, or how do you suggest our colleagues to conduct themselves so that they can compensate for this information asymmetry to keep loyal to the patient?
Right. So I think it's not only the surgeon, it's the team. We all have nurses or physicians, assistants, helpers that really assist the patient getting in to see us, assist the patient getting ready for surgery. So I think your whole team has to be kind of on a certain level of understanding and knowledge that to help the patient prepare for surgery. As I tell my staff, it takes a village of people to prepare, perform, and recover patients from complex spine surgery, right? So you have to have that village of people that are all on the same page. Again, there is kind of a leader. I think I'm the leader of that team, and I have to lead by example. And hopefully, by doing that, my staff will also, have the knowledge they need to perform their duty appropriately, and then assist the patient in getting ready for surgery, getting through surgery, and then recovering from surgery. So, again, I think it's all a matter of getting the right people who are focused on helping the patient. Medicine's a very unique profession, right, for anyone in medicine, because, as you know, if you don't have your health, it doesn't matter what else you have. I mean, if you have your health, then you want everything else, right? But if you don't have your health, you only want your health back. So we are so privileged to be able to take care of people in such need. I mean, have such debilitating spine conditions, whether it's degenerative or deformity. I've seen my family members have severe spine issues, and it's disabling, as you know. So I think we are a privileged profession. Not only the surgeons, but the whole team assisting the surgeon is so vital to providing the best care for their patients to have the best outcomes.
Yeah. So I would love to meet your parents.
Still alive, yeah, 87 years old. They still are both alive.
To thank them for delivering this product, because I think that is in families where the quality of the person.
Well, I'll make sure my parents get a hold of this video to be able to watch it.
Please,
they'll enjoy that.
Let them see them, and I'm going to thank you, Mr. and Mrs. Lenke, for delivering such outstanding human education or value in the education in your child. And two very short questions.
Yes.
I think you have had, because you are a humble person, you probably had like a "is it me" moment. The thing is that probably you start your career, medical student, then specialist, then attendant,
right.
And at a certain point, you ask people who is the most famous deformity surgeon in the world, and many of them are going to say it's Larry Lenke. And tell me your "is it me" moment when you realize that people are saying this about you, and probably you are not still aware of that.
Yes, I don't dwell on things like this, but honestly, to me, the professional pinnacle of my career so far was becoming president of the Scoliosis Research Society. I think at the youngest age ever. I was not even 50 years old yet. So recognition by my colleagues, not by me, but my colleagues, that they, elected me to this position of importance. I mean, it's really quite important and prestigious to become president of this illustrious society and the oldest spine society in the world. So that's, I think, and that was in 2010. So I think, and I was elected actually in 2008. So that I think was an aha moment that, boy, I mean, I really have made a difference, I think, in my profession. Again, I don't look at it in a very egotistical way, but that definitely was a recognition. Everyone would be proud of that. I mean, and anyone who's ever been president of the SRS, I think, should be very proud of that recognition. And that's, I think, what was the first time I really felt that I really benefited our profession.
I agree with you. I will not take more of your time and of your effort after a night-long flight.
Oh, it's fine.
Thank you again very
You're
much
welcome.
for coming, for sharing
Pedro,
your
thanks for
knowledge.
setting up this meeting. Again, I know I've set up a lot of meetings. It takes a lot of work to set this up, and I congratulate you. The program looks fantastic, and I look forward to 2 wonderful days of education here.
Our pleasure. Thank you, Larry.
You're welcome, Pedro. Very good.